And good afternoon. It is I, Charles Moscowitz. Thanks for joining me, everyone. Welcome to the live stream edition of the program, as well as the recorded edition, as I adjust here fervently to make sure things look just right on the live stream. The technology is in place. All right. My guest is Antony Davies. He is a Milton Friedman Distinguished Fellow at the Foundation for Economic Education, an associate professor of economics at Duquesne University. He's the co-host of the weekly podcast, Words and Numbers. He writes frequently for the Philadelphia Inquirer and the Pittsburgh Tribune Review, and has written for the Wall Street Journal, the LA Times, Washington Post, and other publications. His YouTube videos are on economics, government, and policy. Antony, thank you for joining me this afternoon.
My pleasure. Thanks for having me.
Okay, and your book, which is just out and available at Amazon, Cooperation and Coercion, How Busybodies Become Busybullies, and what that means for economics and politics. And this topic is particularly salient right now, given the pandemic crisis that we're in the middle of, and I would imagine that you want to discuss some of the more coercive approaches that are taken by what generally has been the so-called blue state governors. So let's get right to it, Antony. What is going on in terms of these coercive policies, and how are they either helping or hurting our attempt to deal with this terrible disease?
Yeah, and that's the interesting thing, you see. You never know up front what particular policy is going to be good or bad. We make our best guesses, but what we describe in Cooperation and Coercion is the fact that humans, when we come together to solve problems, we always do it in one of two ways. We either work cooperatively on a voluntary basis, or we work coercively. That is, one group of people tells everybody else what they're going to do. And our point is that both tools are necessary, but you got to use them in the right ways. Right, apply the right tool to the right problem. Now, what we did with coronavirus is kind of the opposite of what Sweden did. Sweden used the cooperative approach. Their government said, here are certain things you should do that would make things better, but it's kind of up to you to decide what to do for yourself, given your circumstances. We used the coercive method. Our state government stepped in and said, you will do the following things and you will not do the following things. And what happened is kind of what you could guess going in. In places where those policies were good ideas, they tended to work well. New York City, for example. In places, rural Pennsylvania, where those policies made no sense, they just made people's lives worse. And so you see that this problem with coercion, on the one hand, the positive is you can get everybody in line very quickly. The downside is you get no feedback mechanism like you do with voluntary cooperation when something's going wrong to fix it and make it better.
Mm-hmm. In a way, though, our system and our country has been a lot less coercive than, let's say, South Korea or Singapore or Israel or some other countries where, in particularly the case of South Korea, they literally had people registered through their smartphones in terms of where their location was. And if you were seen stepping outside your property, if you had tested positive, you could be fined up to $10,000. You could serve a year in prison.
Right.
They were monitoring the country with drones, and it was like a complete and utter lockdown. I mean, this country came close to that in some of the bluer states like Michigan, where they were banning more than one passenger in a car, and you couldn't go a certain number of miles, and you couldn't buy, for some reason, gardening equipment or plant seeds in the supermarkets. But it still wasn't that bad. And, I think in states like my own state of Massachusetts, even though we tend to be liberal and the liberal states are more coercive, we still had a Republican governor and we still had a more moderate approach in that the shutdown was more suggestive as opposed to that you're going to get a fine. And it was only in the latter part of the crisis that the governor put into position fines for not wearing a mask of $300. It wasn't like $10,000 and you go to prison. So I think that for whatever reason, the level of coercion that was applied tended to coincide with how liberal the government was in any given state. Did you
I,
notice that trend?
yeah, I haven't looked at the data. It wouldn't surprise me if that were the case. I think one of the things that we tend to forget when we think about the level of coercion that we've employed, we tend to think of it from the perspective of ourselves, of consumers, when the bulk of the coercion in this country fell on the backs of entrepreneurs and small business owners,
Right.
where the government is stepping in and saying, you may not operate your business, and this is the livelihood for this family. The coercive force was felt far worse amongst those people than amongst the general population.
I think if the free market were allowed to function normally in free enterprise, then first of all, no one wants to catch this terrible disease, particularly if you're in an area of vulnerability, like you're over 65 or you're obese or you have a pre-existing condition like cancer or heart disease. You're going to shelter and should shelter. Otherwise, people also would exercise normal precautions, so that they don't expose themselves to it, including businesses. I mean, I would think that restaurants, for example, would put in place measures during the crisis to make sure that there's the minimal amount of exposure because they don't want to have lawsuits.
Yeah,
They
well,
want to. Yep.
yeah, I think you're absolutely right. They don't want lawsuits, and we have this tendency to think about businesses as being only concerned with profit, the bottom line, and from one perspective, that's right. But remember what that implies. If I'm a business, I'm concerned about profit and the bottom line. I'm also hyper concerned with my consumer because that's the source of my profit. And so I'm very concerned that my consumers not get sick. And as a good example, one of the first sorts of voluntary regulations we saw come into play here were grocery stores. They set up all on their own, separate hours. In the morning, very first hours, this was reserved for the elderly. Why? Because that's the point at the day at which the store is cleanest. They've gone through the evening, everybody's wiped out and everything, and if you're elderly can you shop during this period. That was not a government edict. Some grocery store somewhere came up with it, and all the other grocery stores looked at it and said, "Oh my God, that's an excellent idea," and they all adopted it. Why? Because they care about their consumers.
Right.
They care about keeping them safe.
Well, an equally important commodity for any business, besides the actual physical commodity, is their reputation. If
Yeah.
they become known as a place that was a hot spot for the spread of the contagion, that would destroy their reputation. It could put them out of business. It could destroy them as people, I mean, in the community. So we all value our reputation. We don't want to appear that we did something wrong or careless. And I think that power is the power that would, in a sense, result in reasonable measures and reasonable conformity to the situation, while the government, in American tradition, as best expressed by President Teddy Roosevelt, acts as a bully pulpit, right? That they can get up and say, this is what we recommend. And that's basically how President Trump has done this. He's put out recommendations for the states. He's said that you need to have 2 weeks of declining numbers of contagion before you begin a slow and very carefully processed reopening, which is how they've done it and are doing it in Massachusetts. But it's not with a lot of heavy laws. And it's interesting to note that the left generally has opposed this because they think that the president needs to declare an immediate national emergency, call out the National Guard, call out the Army, put in place martial law. And President Trump has, in a sense, acted quite conservatively, for better or for worse. Maybe it might have reduced some cases. I don't know. But the fact is that he has maintained a balance between, handling the pandemic crisis, but at the same time leaving in place a local government control and suggestion as opposed to mandate. What say you?
I think that's absolutely right. I think it was the right move. And I think the governors could have learned, but didn't, something from that. And that would have been to do the same. So rather than the governors employing wall-to-wall policies for their states, pushing things down to the county level and give them guidance, but let individual individual counties make decisions based on the particular circumstances and the needs of the specific counties. Here in Pennsylvania, largely speaking, we're governed by the needs of Philadelphia, which is 3-hour drive from me. But what Philadelphia needs, if we're going to impose a wall-to-wall solution, that's what everybody gets. In my area of Pennsylvania, it doesn't make sense.
Right. Same thing in Boston as opposed to Wendell, out in the western part of the state. And speaking of which, your Governor Wolf, along with Governor Cuomo, is an example of some excess in terms of regulation that actually was detrimental, put in place mandates by executive order that required hospitals to place coronavirus positive patients into nursing homes. Now, I don't, I have yet to hear an explanation for this. I've heard a lot of kind of talking around it and spin, but this is not, in Massachusetts, I don't believe they've done that here. In this state, if someone tests positive for coronavirus and they don't have a place to safely shelter, but they're going to be released from the hospital, there are these hotels that the state rents in Greater Boston, one in Revere in particular, where they go and where there are professionals who can help care for them until they recover. And so we didn't expose our most vulnerable population to this terrible disease, whereas certainly in New York, I don't know about Pennsylvania, but in New York, a high percentage of the deaths from this disease are in nursing homes. To my way of thinking, this is a terrible example of the government coming in arbitrarily and irrationally and imposing a mandate that directly caused death and that hurt people. What say you?
Yeah, absolutely. And in Pennsylvania, I do know the numbers. 70% of Pennsylvania's COVID cases are in nursing homes. By cases, I say cases, deaths. 70% of the deaths, are in nursing homes. It makes no sense to me either. I don't know why they would do this. And this comes to a point that I should have made earlier. We're talking about voluntary cooperation. When you leave people alone to make decisions for themselves, they will sometimes make errors. They'll make bad decisions. But there's an automatic feedback mechanism. If I'm a grocery store and I decide I'm going to set aside the first hour for young people, well, that's dumb. Well, what's going to happen is people are going to stop shopping at my grocery store because they're going to say, well, this guy, he doesn't know what he's doing. He's got stupid policies. You're more likely to get the disease shopping there. And that feedback hits me in the pocketbook, and it gives me an incentive to alter. More than that, I can look around and see what my competitors are doing. They're doing different things. Maybe I should start doing what they're doing. I adapt. That feedback and adapt mechanism that exists in a cooperative environment does not exist in a coercive environment. And so you get a governor putting all of the COVID cases into the nursing homes and people start to die. What feedback is there? There's nobody saying, okay, governor, we're going to replace you with a different governor. We could do that, but that happens 4 years down the road. There's no immediate feedback like there is in a cooperative venture.
Yeah, I kind of equate it to the traffic rules. They're cooperative. They are there as laws. However, people voluntarily observe them because we don't want to get into accidents. We don't want to be killed, and we don't want to kill anybody. So we go out on the highway and we observe the speed limit. We observe the method of going on and off the road and changing lanes. We don't need to have an enforcer there all the time because the laws make sense and because we want to preserve our own self-interest, both in terms of our safety and the safety of other people.
You're looking at a two-lane road on your rural Massachusetts, and you're coming one way and I'm coming the other. That's 10,000 pounds each worth of vehicle traveling toward each other at 140 miles an hour combined. You don't need to put all kinds of barriers in between us. All you need is to say, okay, you stay on the right, you stay on the other side, and you'll pass. And we have a built-in incentive to do that because neither one of us wants a head-on. And so too with the virus. People have a built-in incentive to avoid this thing. All we need is some directive. We don't need heavy-handed government saying you will do the following things.
Now, the virus itself, of course, is real. People are dying. It is contagious. We're all being careful. I certainly am not running around outside without a mask either. No one I know is. But I'm concerned about the political side of this that seeks to take advantage, not only in this agenda to keep people in a lockdown longer than they necessarily need to be, and I think we can begin to venture out and function with a great deal of care, but also such things as a bill number 6666, I think it is, submitted by Representative, I believe, Benjamin Rush of Ohio, that calls for what he calls an army of contact tracers, people who are going to essentially, I don't know, want to use the word spy on us, but if you have been diagnosed with COVID-19, they can then contact anyone that you've come into contact with, going, I think, several layers down. And there are such things in this as that if they find that you were one of the people who might have been in contact with this person and therefore is at risk of getting COVID-19, and you live in an apartment or a house with only one bathroom and more than two people, then you could be removed from the house and put into a special, I don't want to call it a concentration camp. I don't mean to imply that kind of imagery, but right? I mean, in a sense of barracks somewhere until you do a 2-week mandatory isolation. Yeah, these kinds of things are out there, and
Yeah.
it's troubling. I mean, what do you think?
Yeah, I think the thing we got to be careful of is, firstly, I don't think the current situation, and it is, you're absolutely correct, this is a very dangerous virus, but I don't think it rises to the level of warranting the government monitoring our movements all the time and being able to connect this information. But even if it did, we've got another problem, which is if we put such a mechanism in place that allowed the government the power, the ability to track our movements like that, it's not going to go away. After the virus is gone, that system will remain in place and the government will find some other use for it, and it will find uses for it that we find appalling. And yet we would have allowed it to come into existence.
Well, you're getting to a fundamental principle here is that once a government assumes a certain level of coercion, it becomes almost like an addiction. They're not going to give it up so easily. I mean, this whole lockdown was supposed to be only until we so-called flattened the curve, which is to say that the hospitals would not be overwhelmed, and then people could either lock down voluntarily or not, depending upon their condition, and then take normal action once they're out there in terms of safe distancing and all of that stuff. But now there are certain blue state governors, I'm sorry to be political, but it is political, who are hooked on this. They want to keep it going for the rest of the year. I mean, I think that, for example, Eric Trump is quite right. They want to run it until the election, and then the day after the election, they'll drop it. They want to cripple the economy and cripple people, particularly small business people who are on the verge of bankruptcy over this. I mean, it's anything to defeat Trump or anything to exercise this power that they seem to be almost drunk with. Have you noticed that trend?
I have, and it's telling that a couple of the states that are most prominent in rolling back their restrictions, their lockdown, are doing so at the orders of the state Supreme Courts. It's come to that level of the court itself had to step in and say, you do not have the power to do this.
And also bubbling under the surface and as a general threat under the guise of good science is this idea that once a vaccine is put in place, that's going to be a mandatory thing. Now, there's been attempts in the past to mandate vaccines, particularly with children, and that in a sense, it's like the carrot and stick. If you don't get the vaccine, you don't go to school. If you don't get the vaccine, you don't get food. If you don't get, you know what I mean? It's like you'll have to have a certificate showing that you've gotten that vaccine. I mean, these are things that are being spoken of openly and publicly. And putting aside the fact that the vaccine itself, especially if it's rushed into production, could have a very dangerous side effect. I mean, we could look back at the swine flu vaccine of the late 1970s that led to thousands of deaths. The idea that the government would force someone to take a needle into their arm is troubling to me. What say you?
Yeah, I'm ambivalent here, and here's why. A good and proper role for government is in protecting property rights, preventing me from dumping trash or pollution onto your property. And most people would have no problem with that, left or right. The virus, any virus, starts to look a lot like pollution because it's something that I emit as I walk about the place, in the same way that I would be emitting CO2 or sulfur dioxide or whatever it is, some pollutant. And so if indeed that is correct, that the virus from this perspective looks more like pollution, then it suggests that there is a role for government here in protecting property rights. Now, to what extent that role plays of, for example, the government saying either you get this thing or you're confined to your house for the rest of your years, I don't know. But I suspect there is a proper role for government when it comes to mandating vaccine in some fashion.
Okay. I mean, I'm not sure I agree with that. I mean, I think that it should be encouraged, perhaps, especially if it's proven safe. But to cross into a forced vaccine is a bridge too far, from my perspective. It's just it's not the kind of thing that it runs to my way of thinking against the most fundamental property right of all, which is the right to control your own body.
Yeah, yeah, and if you push this example a little bit, and sticking with the analogy of pollution, notice that our pollution laws vary. You have in upstate or the Northeast corridor much more stringent pollution laws than we do here because the style of life is very different there. You've got more people, higher density, these sorts of things. You have different needs. And so one might imagine then not a wall-to-wall vaccine policy, but a vaccine policy that varies based on factors. If you're living in an area in which there are many people who are immune to the thing, no, you aren't required. But if you're going into an area where many people are susceptible, maybe you are required.
Well, I mean, I think early on in the crisis, there was some reasonable measures taken when they discovered a hotspot for the virus. Like I believe it was New Rochelle, New York, where there was a hotspot, and they basically they cordoned it off for a few days and asked people to stay put until it passed. I mean, I think that that's probably a better and more realistic way to handle this. And also on a federal level, the President of the United States did try to put controls on travel from China at the time because that was the epicenter of the virus, and came across a great deal of criticism for that. Then later on from Italy. And I think that that's what a federal government can do. They can make sure that people are properly screened and checked before entering the country, and that airlines have in place a system by which anyone entering and visiting the country is screened.
Yeah.
And then on a local or state level, I would think it's more to do with kind of like dealing with specific hotspots where a virus crops up. I mean, to my way of thinking, that's a much less coercive public policy.
Yeah, and I think your tendency is correct here. We should first be looking to non-coercive solutions. Coercion should be the last thing we use, the last thing we try, not the first. And this is a really important discussion we're having, because when this goes away, there will be a next virus. And the government's response to that will be largely dictated by how the people reacted to its response to this one. If we roll over and say, yes, please help us use whatever coercive means you want, they're going to use even more coercion next time. But if we push back and say, no, you can't do this, you're not allowed, we need to rely on voluntary cooperation first, and government only when voluntary cooperation can't handle it, then the government will tend to be more restrained the second time around.
Oh, I totally agree. And I think that if we approach this thing in retrospect scientifically, like we would approach, for example, an airplane crash, the Federal Aviation Administration goes in when there's a big airplane crash, and they take a look at what happened. What was it a design flaw? Was it overstress? Was the airplane too old? Was it human error? What actually happened? And then they file a report, and they make changes, and they make recommendations to lessen the likelihood in the future. I mean, we could go back in history, and now in Boston they had the Coconut Grove fire, where doors, the place burned down, and doors were not opening out; they were only opening in. The result was over 1,000 people burned to death. So after that, a new regulation was put in to make sure the doors opened out. Something as simple as that. I would hope that this particular pandemic gets that same objective and dispassionate examination, a very scientific examination. And one thing I think they're going to find is the numbers, and we should make them be honest about this, because so far they've been very sketchy, including in Massachusetts. But the numbers of people who died in nursing homes, and how we can protect nursing homes going forward, and other segments of our population that are vulnerable. I mean, to my way of thinking, this is one of the elements and stories in this thing that we need to come to grips with, and we need to hold accountable those politicians who didn't understand this for some reason. Something that any school kid would understand. You don't put someone that's sick in a nursing home.
Yeah, absolutely right. My suspicion is when the dust settles and we look back on the data, and this is going to take a couple of years till we get to this point, I think we're going to be shocked that we were told that the number of people who are going to die from this disease were orders of magnitude beyond what was actually the case. Is this a dangerous disease? Yes, it is. Is it Armageddon? It doesn't even come close.
That's right. Okay, so Antony, let my listeners and viewers know where they can hear your podcast and where they could get your book or any information about you and your website or whatever.
Our podcast is Words and Numbers, and you can find it on all the major podcast players and at wordsandnumbers.org. And our book is Cooperation and Coercion, available on Amazon.
Excellent. All right, Antony Davies, I want to thank you for joining me this afternoon.
My pleasure. Thank you.
All right. Have a good one. Thanks. All right, Antony, I'll send you a link once it's up on YouTube.
Okay, man. Thanks so much.
Thank you.